Welcome back to CT Style. If you suffer from chronic pain and are looking for relief that doesn't involve surgery or medications, our next guest might be able to help. Here now from New England Spine and Disc is Dr. Richard Karpenos and one of his patients, Legem Washington. Thank you both so much for joining us.
Thank you for having us.
So,
Great to be here. Thanks.
Doctor, of course, tell us about New England Spine and Disc for those who might not be familiar with what you do.
Well, we are at 391 Boston Post Road in Orange, busy corner of Post Road, and we treat joint pain, back pain, neck pain, shoulder pain, and also disc problems. So that's really my area of expertise. Herniated discs, stenosis, bulging discs in the neck and the lower back. But this new technology has been sort of a big breakthrough in all of Connecticut.
And a lot of people do suffer from chronic pain. So tell us about this device. How does it work?
So this is a patented instrument. There's 46 patents on it. It's manufactured in Germany. It's called the SoftWave TRT. And it is a non-invasive way of stimulating your dormant stem cells. We all have these healing cells in our bone marrow, and this activates them to take them to the area where you have chronic or acute pain. And we've been able to cancel hundreds of knee surgeries, even knee replacement surgeries, or if you've had a surgery and you're still in pain, we've had an amazing success rate in that. And also athletes like Legem, who's a cheerleader, and she could tell your story, but we love treating sports injuries as well.
Yeah, and Legem, I do want to get into your story before we try this out. We'll show our viewers today, but tell us about what brought you to Dr. Karpenos in the first place.
So I've been having knee problems since 2016. I was 12 years old because of cheerleading. And so in the fall, it got really, really bad to the point where I couldn't do anything that I wanted to do.
Right.
Like I had problems walking. I went to the pediatrician, went to the orthopedic, nothing. They told me I might have arthritis, and I'm like, I'm 17 years old. There's no way. And it was actually my mom that went to his office one day, and she came back to me and she was like, you know, I feel like really good. And I was like, yeah, okay, whatever.
Right.
And
and while you continue the story, let's give this a try. Show our viewers, you know, as we hear the rest of your story.
Yeah, it'd be awesome to show how it looks.
Absolutely, because, you know, we want people to see how, so in-office procedure, 10 minutes.
Yes.
It's less than 10 minutes.
Not even.
And you've had about 8 procedures, you were saying.
Yes.
So far. Have you noticed a difference?
Yes, completely. Like as soon as I get off the table, like I feel like I have new knees.
Wow.
Yeah.
So what is this noise? I see a light. What's happening here, doctor?
Great question. So those are acoustic waves that are produced by a hydroelectric spark inside, but none of that electricity can get into Legem because there's a silicone shield. Only the acoustic waves come in, and they're unfocused, so they cover the entire area. And as those waves come in, you have a huge increase in blood flow, about 300% in 20 minutes, and pain just seems to disappear, as well as inflammation. The before and after a 3-minute patient treatment sometimes yields like tears. I've had people collapse because they just cannot believe that it's their joint that they are in so much pain with.
Wow.
We've had patients who couldn't walk up downstairs, who are on canes, and they've all been able to do well. It's an amazing treatment.
It's
and
fascinating.
Quick.
I mean, the proof is in the pudding right here. Quickly before we go, tell us, you know, how does it feel for you? She says she feels like she has a new knee. How does that feel?
It's unbelievable, and I don't want to take any credit. This equipment is amazing. I learned about it because the Hospital for Special Surgery uses it, and a lot of sports teams have it, and I'm a sports fan. She's a cheerleader. So to be able to help her so that she could complete her year, it's just one of the most rewarding things you could do in my practice.
Well, Legem, I'm glad you're feeling better. I want to tell people where they can learn more, NewEnglandSpineandDisc.com, and that is it for CT.